our next speaker, her name is Kylie Everhart, and she is from Friday Health Plans. Friday Health Plans is sponsoring our mental health and wellness track here at Austin Startup. How's it going, Kylie? How are you?
Hi, Tony. I'm good. How are you? Where's my stuffed animal?
I should send you one. Just
I
we gotta
know. I
connect.
want a new plushie every time. New plushie.
Kylie's going to talk about debunking the myths of health insurance, affordability, new options, and real world examples. Again, Friday Health Plans just recently expanded in New Mexico, Nevada, and Texas, and they originated in Colorado. Did I get that right, Kylie?
Yes, you did.
Oh, awesome.
Yes, you did.
And yes, I will get you a plush animal. And my plush animal, just to let you know, guys, got a flu shot. So make sure you guys get a flu shot. It's very important, all right? I'm going to let Kylie take it over, and I'm very excited to listen to your presentation.
Thank you. So we should already be sharing. There we go. Well, thank you very much, Tony. Thank you, everyone. Thank you, Morgan, for that really awesome presentation. You hit on a lot of items that I will also be reiterating. So we're going to go through today debunking the myths of health insurance. I would put a picture of myself up here, but I think y'all are getting quite enough of my face. So we did a picture of a cow instead. That works. So I am Kylie Everhart, Director of Sales for Friday Health Plans here in Texas. And as Tony mentioned, we are a startup health plan that has expanded now into Texas, New Mexico, and Nevada, originating in Colorado. So just going through this very quickly, and I will leave questions or time at the end for some questions. Let's see here. Why is this not going? Just a quick overview. Are you not insured by an employer, and how to do that? How to insure yourself solo. If you think you can't afford it, maybe think again. There's a lot of options out there. Are you wanting to insure your employees? And you certainly have options to do that. And insurance situations in real life, affording insurance for yourself and or your employees. So who is Friday Health Plans? Friday is a health insurance company that was purpose-built for people who buy their own insurance. We are a startup with a 50-year-old history, and that is something that is different that we have. So our company was started in 2015 by our co-founders, Sal Gentile and Dave Pinkert. In 2017, we purchased another health company called Colorado Choice Health Plans that is based out of Alamosa, Colorado. And Colorado Choice has a 50-year history. So we are a startup plan that has really deep roots so that we can service our clients. We have great customer service, broker support, customer support, claims. We expanded into Texas because there's a vibrant startup community here. I myself personally officed out of Capital Factory with Kind Health for a little over a year. So, we've been in that world. I've been in the startup world for many, many years now, and it's just a phenomenal environment and a phenomenal group of people. Friday Health Plans offers, we really enjoy and value access to care. And like Morgan mentioned in her presentation right before this, having that access to mental health is super important. And that's why we make that a $0 cost on all of our plans. And that's in person and online. So in Texas, we partner with a company called Sondermind, which allows mental health visits in a virtual environment. So you can call or do an online visit if you're not comfortable or feeling like you want to leave your home, or you can go into an office and pay nothing for it. That is super important to us, is that you don't have to meet a deductible. You don't have to have a copay. You should be able to use your insurance because you're paying for it. And so being able to see your primary care doctor or a mental health professional for $0 is something that we will always do if I have my say of it. We also offer $0 generics. So being able to access your care, access the things that you as individuals really find important, that's also important to us. So a little bit about me. I've been in health insurance for close to 20 years. I spent the majority of my career on the agency side, so dealing with all of the insurance providers across this country, helping to build a startup in Kind Health, which is an amazing company based here in Austin. And in May of this year, I moved over to the carrier side because I felt that I could make a difference here. So I'm, again, really super happy to be here. Just a little bit about Friday, our advertising. I'm not going to bore you with all of the reasons to buy health insurance. Everyone here is a risk taker. If you weren't a risk taker, you wouldn't be in a startup. But risking like a bankruptcy due to a car wreck or COVID-19 or another illness or accident is really not worth that risk. So get insurance. It's more affordable than you think it is, and it's more accessible than most people think it is. Buying insurance is not necessarily at the top of everyone's mind. And it's a common misconception that not everyone needs it, or it's only available through your employer, or that young people that are in their prime don't feel like they need to buy it. So who needs health insurance? The answer is very, very simple. Everyone needs health insurance. And yeah, if you're not on the company plan, there's a plan for that too. All right, so flying solo health insurance. And this really does take me back to Capital Factory on that Star Wars floor, the flying solo. The Affordable Care Act. That's a great option. It's really the best option when you're looking for health insurance on your own. The Affordable Care Act was put into place in 2014 and really made health insurance widely accessible to the majority of the American people. Part of that Affordable Care Act took away exclusions or rate-ups for pre-existing conditions. And again, I'm not going to try to bore everyone with health insurance terminology. But prior to the Affordable Care Act, if you were unhealthy or you had a pre-existing condition, you could either be denied insurance or you would be rated up. And rating up means that they're going to charge you $50 to $250, or $50 to 250% more because of that condition. And that's not right. If you have a pre-existing condition, you have every right to receive health insurance, just like everyone else does. The Affordable Care Act also brought into play the 10 essential health benefits. So you can get a wellness exam for free. You can go for your annual and be able to keep yourself healthy, because that's really the purpose of health insurance. It's not really to use when you're sick. It's also to keep yourself from becoming sick. And then no health insurance company that is an Affordable Care Act or an ACA compliant company can deny you coverage. There is no underwriting. So, it's always best to look at the Affordable Care Act and look at healthcare.gov when you are looking for insurance options. And then how to buy that. You can buy on the marketplace. You can go to healthcare.gov. You can go to Health Sherpa. You can go to Kind Health and be able to purchase health insurance through either an EDE partner, which is an enhanced direct enrollment. Again, not trying to get into the terminology, but I can't help myself. You can go directly to the insurance company. You can come right to our site at fridayhealthplans.com, look at our plans, and purchase a plan directly through us. Or you can use a broker. We have a little over 1,000 brokers at this point, headed on our way to about 3,000 brokers in Texas. that can, review all of the options that are available to you and go through how you use health insurance. Because all of us are different. We all have different needs. Maybe we see the doctor a couple of times a year. Maybe we have a pre-existing condition and have to see a specialist, or maintenance medications. And so being able to go through all of those nuances with a broker, or telling the Affordable Care Act or healthcare.gov what you need in your policy will help you to determine something that is suited to you. Part of this, there is a giant underserved community. And a lot, unfortunately, it seems like the healthy-minded is almost the largest underserved community out there, because of we maybe get sick 2 or 3 times a year, or need to see a doctor because we have a cold or the sniffles. We're not very, very ill, and don't need to see a specialist. That happens, and those of us who are healthy-minded, who really don't need health insurance all the time, but it's always something that we have to have, we end up going into higher levels of coverage because we want those copays, or we want the free generics. And so at Friday, we've made that available at all levels so that we don't have to force individuals into a higher level of coverage than they actually need. On the Affordable Care Act, healthcare.gov, you can qualify for a subsidy based on your income. And we'll go through kind of a real life situation a little bit later in this presentation. But honestly, 4 out of 5 people who purchase their insurance on healthcare.gov receive a subsidy. And what that means, it's based on what's called the federal poverty level. Anyone who is up to 400% of the federal poverty level can receive a subsidy. So if you are under 400% of federal poverty level, you can get help paying for your health insurance by the US government. That is what the Act did, and that is what it is. And so some examples of that: if you're a single individual purchasing health insurance and you have an income of under $49,960, you can get a subsidy. A couple, either your spouse or partner, with income under $67,640. A family of 3 with income under $85,320. Am I freezing? Can y'all hear me? Oh, good. Cool. Thank you. Or a family of 4 with an income under $103,000 a year. So those are some real numbers. That is our 2021 federal poverty levels for these situations. So if you don't think you qualify for a subsidy, check it out. You certainly may. This is based on what is called MAGI, or modified adjusted gross income. So whatever your income is, after your deductions, after all of the things that you take as an independently employed person, that is your adjusted gross income, and that is what your subsidy would be based on. Other options are opting out of your employer's health insurance plan. And this isn't something that we think of all the time. If you or your child gets insurance from your job or your spouse or partner's job, it may be cheaper to buy an individual plan. For an example, take Joe, who is 35 and gets his insurance from his employer. His employer pays 50% of his monthly premium, and Joe pays the other 50%. So because Joe's employer really wanted him to have very rich benefits, it's a fairly expensive plan. So total $600 a month. Employer pays $300, Joe pays $300. In Texas, it's only required for employers to cover 50% of the employee-only premium. So when Joe puts his child on his company health plan, it costs an additional $600 a month. If he went to healthcare.gov and bought a basic plan for his child that covers well baby exams, that has doctor's office visits and prescriptions, that could cost him less than $200 a month, which is an enormous savings. Oh, I have to learn not to scroll. Sorry, I need to just hit my little buttons here. So insuring employees, you also have options for that. With small group insurance, just a quick summary. A small group in Texas is businesses with 2 to 50 employees. So definitely that sort of micro group startup environment, which is really awesome. With small group, the employer selects the plans that are going to be offered to their employees. So you can say, I want 3 plans to offer my employees, kind of a low and high. Or you can offer 1 plan to your employees. It's up to the employer to select the plans. The monthly cost of that is typically split between the employer and the employee. And again, in Texas, it's only required that employers contribute 50% of the employee-only premium. So some pros and cons to small group insurance. Pros, it's familiar. So group insurance is really, really common. And so there's a really good chance that your employees have heard of it, and that makes it something that is easier to offer, and the employees recognize that benefit as being valuable. You can attract talent. So the first benefit of offering healthcare is to attract and retain talent. That is something that all employers want to do, especially in the startup community where you're attracting talent to help grow your business. Shared cost, the employer, it's typically shared between the employer and the employee. And then an increase in productivity. So this goes back to something that Morgan was talking about. American workers take over 3 billion sick days per year across the country, 3 billion, costing businesses untold dollars in lost productivity. On the other side of the coin, the cost of presenteeism. Presenteeism is those who come to work sick. So they didn't take the day off, but they have the flu and they're sitting in your office or sitting in your pod if you're at Capital Factory and you're asking them to please get away from me because you're sick. That also costs billions in performance costs and loss. But when employees have access to healthcare, they're likely to use those services. They're likely to go to the doctor if they have a cold or the flu or COVID, and to really take care of themselves rather than having to wonder what I'm going to do if I get sick and I don't have access to care. You can self-pay, you can go to an urgent care, but that can get fairly costly. So having a health insurance plan is really important. Some cons. So the employer has to pick the plan and manage those insurance options for your employees. So that's additional work in managing and administering the plan, choosing the plan, deciding which you're going to choose for your employees. There's a participation requirement in Texas, so 75% of your employees have to participate after what's called a waiver. So if you have employees that are on their spouse's plan, they can waive your insurance. Unfortunately, waivers don't count if they're just if they're not participating due to cost. So you do have 75% of your employees do have to participate. Again, you have to contribute 50% of the employee-only premium, and those costs can vary on an annual basis. So those are some pros and cons to health insurance in the small group space. something that came out in 2020 was what's called the Individual Coverage Health Reimbursement Account, or an ICHRA, ICHRA. And ICHRAs have made a huge splash in the employer and employee group space. Excuse me. ICHRA has several advantages over traditional group plans because what you're doing is contributing pre-tax dollars for your employees to use to shop on the individual market. So what you're doing is not only are you providing a benefit to your employee, saying, I'm going to give you X number of dollars per month to purchase health insurance, you're also giving that employee the option of choice. So they can go out and choose whatever plan they want, whatever plan works for them, rather than having to select from a few that you on a small group plan. You can offer these to different people within your organization. You can do a group plan in additional to an ICHRA plan. If it's seasonal employees or temporary employees or part-time employees, you can offer them an ICHRA while you're there. It also helps to kind of control your predictability with cost. So having that, if you have a fixed amount per employee or a fixed amount per family, then you have the ability to know what that cost is going to be on a year-to-year basis based on how you are going to grow. So for example, you're saying, I'm giving my employees $100 a month, and I'm going to add 5 new employees over the next year. Well, then you know that you're going to add $500 a month spend for those 5 new employees. It's just a really great amalgamation of a group and independent plans that you can still provide a benefit for your employees. Insurance in real life. And before we get into these, I want to kind of go through some statistics that we had on the uninsured rate across this country. So 8% of this country is still uninsured. That equates to about 20 million people who don't have insurance in any way, shape, or form. So they're not on Medicare, they're not on group, they're not on individual, and they're not on a state-based plan. In Texas alone, since the pandemic started, 695,000 people have lost their coverage and are coming into the individual market. 695,000 people is a lot of people. And some of those individuals may have decided, you know what, I'm not doing this anymore. I'm going to start my own company. And so those are people that are like you, just decided that I can do it better. And so they are entrepreneurs, solopreneurs that are ready to go out on their own and really may not understand how to get that insurance. And so that's why we're trying to, again, debunk those myths of, I can only get that through my employer, or I can't afford it, or I'm not going to get any help. So that's really important for us at Friday to, educate the world about insurance is not something that is elusive. It is something that we can certainly get behind and get ourselves and our families covered. So getting into some of these kind of real world scenarios. I'm going to use Jacob, a WordPress contractor. Jacob works for himself and decides to get insurance. He makes about $40,000 a year, but with his expenses and tax write-offs, deductions, his adjusted gross income, remember we talked about that, is $35,000. So Jacob goes to healthcare.gov, the marketplace, and learns that he is going to receive a $118 subsidy based on his income. Jacob goes through, looks at Friday Health Plan's Bronze Plus plan, that allows him the unlimited $0 primary care and mental health visits, free virtual doctor's visits, and a $75 copay for his urgent care. This plan originally is $265 a month. These are the rates as they look right now, but final rates will be released by CMS or healthcare.gov on November 1st. With his subsidy, Jacob pays $147 a month for a plan that gives him unlimited primary care visits, unlimited mental health visits at $0 cost, free virtual visits for primary care and mental health. So we use Teledoc. So Jacob can see a Teledoc person. He can see a Sondermind therapist from the comfort of his home and not have to pay anything for that. And then that $75 copay. And on this plan, we also have a copay for generic drugs. In our next scenario, we have ABC Tech Company. So Dave is the owner of ABC Tech, an upstart that employs 6 full-time salaried employees, 2 seasonal, and 8 part-time. Dave has always offered health benefits to his full-time employees, but he wants to offer benefits to his part-time and seasonal employees too. In offering an ICHRA to his part-time employees, in addition to his group health plan for full-time employees, Dave can competitively recruit and retain top talent at management and frontline levels. So he offers part-time staff an ICHRA and contributes $150 a month to their account. And he's offering his full-time salaried employees a traditional group plan and contributes that cost. So that's an example of how you can split out your traditional group and your ICHRA plans. To really retain that talent and make sure that you have a healthy workforce. Our next example is Fast Bike Parts Manufacturing. So Leslie is the CEO of this company. She employs 5 full-time salaried, 8 part-time employees, 10 seasonal employees. So her solution is an ICHRA. So she's offering her salaried managers an ICHRA and contributes $300 a month to their account for her salaried managers. She does not offer hourly employees health insurance, but she does encourage them to get insured through the marketplace where they will get a federal subsidy. So here's the situation. If you are offered a health plan by your employer, but it's not affordable to you, you can go onto the marketplace and purchase an individual plan. But if you have that coverage offered, you no longer qualify for a subsidy. However, if your employer just does not offer that to you, at that point you qualify for a subsidy. So in some cases, it works out better to say, yes, I'm giving this amount to this group of people, but otherwise I'm not offering insurance. Because that then allows that individual to go online to healthcare.gov, enter their information, and get a subsidy based on their income, and likely get a very affordable health plan. So insurance is a very complicated topic. And so I wanted to allow quite a bit of time for your real world examples and questions. I don't know if we have any questions at this point. Not currently. Come on, y'all, ask a question. There's got to be something out there on health insurance that you want to know. Still no. So I'm putting up my information here. Again, I'm Kylie Everhart, Director of Sales for Texas for Friday Health Plans. My email and, how can someone get a quote? So starting the last week of October is when healthcare.gov will open up first looks, and you can start getting quotes there, and you can enroll on November 1st, which is when open enrollment starts. If you're a small group and you would like a quote, please reach out to me at the email that's on your screen. We can certainly provide a quote within 24 to 48 hours on how we can cover your group. Yes, Christy, there is a place that you can compare options. Specifically in the individual market, you can do comparisons on healthcare.gov. That will let you see all of the insurance carriers that are in your area. In Texas, we have 8 insurance carriers that participate on exchange, 9 now including Friday Health Plans. And you'll be able to see all of the prices and benefits compared to one another. There are things that we go through that are called metal tiers. So there's bronze, silver, gold, and platinum plans available. And so if you think of that kind of in those tiers, so there's bronze, which is kind of a basic tier, silver is better, gold is even better than that, and platinum is the highest tier of coverage. You can look at all of those through healthcare.gov. You can go to sites like Health Sherpa or Kind Health that offer shopping tools. You can also go directly to Friday Health Plans if you just want to compare our plans. But the purpose of this was not to sell our plans, it's to talk about insurance in general. And so you can go onto any of those sites and see benefits across the board from all of the carriers that are available in your area. Some of the questions not being asked that we should be communicating. Some of the things that you should look at when you're enrolling in your health insurance is how quickly you can access your care. Very traditional plans that are HSA, that you have a health savings account with, your benefits are going to be subject to a deductible. And so you'll be paying out of pocket for those benefits until your deductible has been reached. That means that if you go to the doctor, they will take your information, they will submit a claim to the health insurance company, and then you'll be billed for that visit. Then you also have copays. So copay comes into play when you do not have to meet your deductible first. So with Friday Health Plans, for an example, on our Bronze Plus, Silver, and Gold plans, we have a $0 copay for a primary care and mental health visit. So when you go in to see the primary care doctor, pediatrician, OB-GYN, or gynecologist, I'm sorry, I'm trying to stay away from too many jargon terms, you don't pay anything for that visit. When you go in to see your counselor or therapist, you don't pay anything for that visit. That is 100% covered by the insurance company with Friday Health Plans. So those are things that you want to look at and determine what is best for you and your family. Do you want to have everything to an HSA, where you have an HSA account and you can contribute to that monthly or on every paycheck and then pay for your care there? Or do you want to have copays that are more important, so you know when I see my doctor, I'm going to pay X number of dollars, $0, $25, $50, whatever it is that company is providing you. You want to look at what an emergency would look like. So do you want, or do you want to go to an urgent care? Friday, we have a copay for an urgent care. so that if something does happen, you can go to that urgent care facility like a Care Now and be seen. So middle of the night, ear infection with a baby, or you wake up with a high fever, you can go to that urgent care facility and know that you're going to be able to be seen. Those are some things that you want to look at. Your deductibles and out-of-pocket maximums. Again, this gets really into the weeds when it comes to health insurance, and so we really wanted to talk about it. An out-of-pocket maximum is the most that you are going to spend in a per person on your policy. So that means we'll use $8,000 as an example. If you go into the hospital and you have a major instance happening, there's a maximum amount of money that you are going to have to pay before your insurance has to cover you at 100%. And so if we're using that example of $8,000, the most that you would pay for anything that you do in the year is $8,000. And that, of course, is not subject to copays or anything like that. So really looking at those deductibles, those maximum out-of-pockets, your copays, and really before you start any of that, it is assessing your needs. How do you use your health insurance? And if you're not using health insurance, why? If you don't have health insurance, why don't you have health insurance? Even if you only see your doctor, maybe you're on a maintenance medication, but if something happens, you coverage. And that can be a really scary place to be. So really assessing your needs and understanding what it is that you and your family need from your health insurance. We're getting some other questions. Is open enrollment the only time you get to get covered? Open enrollment is the only time that you can freely purchase health insurance with an ACA compliant carrier. So that's a major medical carrier like Friday Health, like Blue Cross Blue Shield, or Ambetter, or Molina, or Oscar, or Sendero, depending on where you are, Christus, Community Health Choice, I'm not going to name them all. But you can look at and shop and change your plans once a year, which is during open enrollment. Open enrollment starts every year on November the 1st, and it ends on December the 15th. So you have a 45-day window in which to choose your health insurance plan for the upcoming year. Now, outside of open enrollment, there are special enrollment periods, and those come into effect if you have some sort of life-changing event. If you lose your job, so those 695,000 people who had the ability to go out and shop for insurance. If you have a baby, if you get married, if you get divorced, a life-changing event can open up what's called a special enrollment period in which you can choose a new health plan. You can add someone to your health plan. You can drop from your health plan. So Friday the next question was, what was the date Friday would open enrollment? So November 1st is the beginning of open enrollment. Unfortunately, we can't start quoting until that date, but that is coming up sooner than we think. We are less than 30 days away. Am I the broker and able to match with the best plan? I am a licensed agent, and I can certainly help you with a plan, but I am not a broker. But I can absolutely, if you have a question about that, send me an email. We can discuss your needs and what you want from your plan, and certainly walk through what is best for you. I think that's all the questions. Are there any interesting trends that we're seeing in 2020? Yes, the ICRA was a very interesting trend that came up this year, and it's being widely accepted in the employer group space for all of the reasons that we talked about, affordability, choice, sustainability, administration. All of those are really making an ICRA a super option for small groups to utilize. If you have any questions about that, please let me know. We do have an ICRA specialist on staff that can talk to you, and we have administrators that can help with determining the need of your company. I only have about 3 minutes left. Are there any other questions that anyone has, or did I miss anything? No? I'll use this last time just to, again, thank everyone for being here, for listening and looking at my face for the last 45 minutes. I appreciate you all for allowing us to sponsor this track because, again, mental health and physical well-being are so very, very important, and it's become so much more prevalent in the last 7 months that we have been trapped in our homes and, dealing with COVID. So if there are any questions, if you just want to chat about health insurance and what that means to you, please reach out to a trusted professional, a broker, an agent, me. I have a team here in Texas that are in Houston and Lubbock and DFW and San Antonio, and we would be happy to talk to you what that means to you. I really hope that you all have a phenomenal rest of your day in this mental health and wellness track, and really looking forward to a successful startup week and watching the rest of it. And I hope that you all have a really great rest of your day.
All right. Well, thank you so much, Kylie. Again, thank you, Friday Health Plans, for sponsoring our mental health and wellness track at Austin Startup Week. Kylie, I learned a lot. I learned about carriers, shopping around, how to work with brokers. Again, we all have different needs. So please go ahead and check out Friday Health Plans. Kylie, please share with you your contact information. I know open enrollment is pretty big. When I was working at the city of Detroit, I was actually working with a lot of brokers to talk with Medicare, the Medicare population, to make sure they had Medicare Advantage plans so they can look for the needs. So it helps a lot to address the social determinants of health back in that city. So thank you, Kylie. Again, my name is Tony. I am your track advisor for mental health and wellness. What we're going to do next is we're going to do networking. You have to network. You have to meet new people. I understand that it's kind of hard right now, especially with COVID, but you need to meet new people, so you can find new opportunities and see what you're capable of doing. Make sure you share your LinkedIn profile link on our chat box. So go ahead, drop it, your link, just so people can see, and maybe you guys have some type of connection and y'all can connect together via LinkedIn. On your left side, there's a networking icon. Go ahead and click on there so you can go ahead and meet people who are watching me right now, and you all can network together. I know I'm going to be networking with my little friend right here, this little puppet. His name is Star-Lord, and we're going to network and talk about Austin Startup Week. So again, networking is very important, especially for Austin Startup Week. And that's pretty much it. So go ahead and start networking. Click on the networking icon, and I'll see you guys pretty soon.